Welcome, everyone. My name is Shirley, and I will be your moderator this evening. Tonight's webinar again is titled How I Place 150 Implants Per Year as a GP. And we are thrilled to have Dr. Brett Titensor, a passionate advocate for digital dentistry and a CEREC mentor, trainer, and visiting faculty for cdocs.com. That's CDOCS.com with us today. So before we get started, just a few housekeeping rules. We'd love for this to be an engaging conversation. So if you have a question, please go ahead and type it into the Q&A box. And as you heard, Dr. Titensor will be addressing them as we go along, and then also at the end of the webinar. CE is not available tonight for this webinar, but we will be sending out the recording sometime over the next week to everyone who registered. Well, with that said, Dr. Titensor, this is so exciting. Welcome, and thank you for being with us. I'm going to pass it over to you now.
Perfect. Thank you. Well, welcome everybody to tonight's webinar. I appreciate you taking the time away from Olympics and other things that you may have going on. Hopefully we can jam-pack this next hour with some really good information that can help you with your implant journey and as a dentist. First of all, yeah, like she said, I don't mind interaction. If you have some specific questions you're hoping to get addressed, feel free to use the chat. I'll try to answer as many questions as I can and as I go, or you can put a specific question in the Q&A and we can answer that at the very end. I first wanted to address the title of the webinar. You know, we're coming up with names. Wanted something to grab you, to catch you. So, you know, how to place implants and how to place 150 implants per year as a GP. Thought that would be catchy. Now, I know some of you may think that's a lot. Some of you may think I do that in a month. What I wanted to emphasize is just some of the things that I've learned in the past few years. From the year 2019, when I placed my first dental implant, until now. I did find we ran the year in the last year from the time about a month ago to a year before that, I placed 150 implants. So as I was coming up with this, I was just trying to figure out what were some of the factors. And that's what I want to show you tonight. Just a brief introduction on myself. Dr. Brett Titensor. I have done some lectures for Dentsply Sirona and for Henry Schein. Love doing that. It's a great way to meet fellow dentists, keeps me on my game. But all in all, I am a general dentist. Even gone to places like the military. They're adapting a lot of this technology. So I've been on base to teach some of those things. I practice in Dallas, Texas, a town called Flower Mound. So this is the practice. You'll see I love technology. All right, I kind of have it all. You name it. I have a cone beam CT. I have two intraoral scanners, the Prime scans. I have the Prime Mill, 3D printers. You name it, I love it. I really feel like it's kind of molded my practice to where it is today. And it's with this technology that really I feel like has helped me boost the amount of implants I placed, and that's what we'll go over tonight. A few disclosures. They're compensating me for this webinar, but I do not make any money off of equipment purchases or anything like that. You'll notice, I always like to say this, you'll see I am commercially biased towards Dentsply Sirona products. I find that their workflows are amazing. I have used other ways. Some of the things I'll show you, you can use with other companies and other hardwares, but it may be a little more difficult, maybe not as smooth as easy. And so you'll notice that, yeah, I favor those. And I have not photoshopped any of the images. All right, so some goals for tonight. Just want to review some of the contributors that I feel like I found that's increased the amount of implants I place in my practice. I'd love to show you actually a live demos on how to use some of the softwares I do that makes this possible, that makes it easy. So a demonstration on how I plan out the implant and even to how I 3D print the surgical guide, time depending. Live demos, there's always, the chances of hardware hiccups and things, but I think it's important to see it live and not cookie cutter, but actually see how it's done. And then all in all, you'll see that these things have just boosted my practice. It's made the patient experience better, doctor experience better. My case acceptance has gone up, and it's really simplified the dental implant process. All right, so just hit it right off the bat. First, you got to invest in continuing education. I took some implant continuums right out of dental school. I knew this was something that I wanted to do. There's a lot of good ones out there. Just webinars like this, right? Through Henry Schein Academy. I can't thank them enough for inviting me on here. There are so much resources online where you can watch videos for days. This webinar will be posted even that you can refer back to. So I really encourage you to get on and continue to learn. I got a shout out to Dentsply Sirona World coming up here in September. If you've never been to this event, it's a great event. You can kind of where I got my start into this technology. I will be teaching a course there, little teaser carrot, but another great opportunity coming up. All right, another contributor. Can't tell you enough how much investing in technology pays off. All right, from intraoral scans to cone beam CTs, 3D printers, even the ability to manufacture the restorations in office. The cases that I'm going to show you tonight, I feel like would not have been possible if it wasn't for this technology. I'll show you how each one I've incorporated to make the implant process seamless. And now even, there's data coming from all these different hardwares. Sometimes that was confusing, made the workflows tough. So a lot of this is now uploaded straight to the cloud, which keeps all the data in one place, again, making the process simpler. Some of the things I use the technology for is one is just patient communication. All right, you got to sell. You can learn everything you want about implants, but you got to sell the treatment, right? And I find our patients, they really want to know what's going on more than ever. How many patients come to you and say, oh, I've already Googled that, or they've done their own research, right? Well, in my office, if someone's getting a dental implant, I always show them their cone beam CT. And I walk them through, answer questions, show them what complications may come up. Here's an example. So here's a case where a patient at site number 14 needs a sinus lift. How do you explain a sinus lift to a patient without showing them something like this, right? Very difficult thing to do. Before technology, what would you've done? You'd say, hey, you don't have enough bone, but we can still get an implant, you need a sinus lift. And then really the only thing they see is the extra cost added to the procedure when they walk up front. Not a great scenario. Versus with the technology, I actually show them why it's necessary. I build that value. So then when they see the extra cost, they understand and they're more willing to move forward with treatment. Here's just an example of what we call the SciCat software. It's amazing. You can mark the nerves, you can place the implants where you want them to go. All of this making it predictable for me as the clinician. It tells me what to avoid, what I feel comfortable getting into, and it's something I can talk to the patient about. You always want to tell them, hey, here are some of the risk factors, and here's some things that could happen. So that way, if it does happen in the procedure, they were informed. On the flip side, if it doesn't happen, you're the hero, right? So really informing the patient using this technology has made that patient experience so much better. And imagine if a patient came to me for dental implants and I showed them how I'm going to plan this out. We're measuring twice, cutting once, all this cool technology, and they want to go get a second opinion. And that second opinion doesn't have this. Who are they going to feel more confident moving forward with? I tell you, it's a really big confidence booster in your patient when you can show them these things. Another contributor, and I'm really going to hit this home, is it's got to be an easy workflow. All right. And when I say easy, the implant dentistry can be difficult. I'm not going to simplify it too much, but I'm talking about just the workflow, the way to produce, um, um, how to plan the implant. Software needs to be easy. It needs to be easy to produce the surgical guide. It needs to be easy to place the implant, and it needs to be easy to restore the implant. I'm going to show you a few cases and as to why that's important. So what is the digital implant workflow? What does that look like? In my office, you start with data capture. So you get a cone beam CT and an intraoral scan. From there, we can plan out the implant placement. We can do the guided surgery, time of placement, or after things have healed, we can scan for that final abutment and restoration. I can even mill these full contoured screw retained implant crowns in my office. So from start to finish, we can get the patient from missing a tooth or a broken tooth into a restored implant, all in-house. And that flexibility really makes it for a better experience for the patient, for the dentist. It gives me control. I'm not worried about a lot of the lab communication issues. I'm not worried about shipping. When you can take things in-house, it really makes it easy. So again, we take a 3D scan, we take an intraoral scan, we merge those two datas together. You can even design with the software that I use, you can design the final restoration. So that way, when you are planning your implant, you can actually see where that final crown location is going to be. Really nice, especially when you're starting to get into multiple implants in a row, can make something that can be pretty complicated fairly easy. And then from that plan, you can produce a surgical guide, whether it's milled or now we just exclusively 3D print these. And then placement, all the way to placement. So it's my surgical guide evolution. Before I could 3D print these in-house, it was a question of whether or not I should move forward with a guide because one, it was expensive, right? If we order it from a lab, it usually costs us $360 and it would go up from there. If you did multiple implants, the cost would go up. So, it was one of those things that it would put a hesitation as far as whether or not you'd get a 3D surgical guide. From there, I developed and started using third-party softwares. Now I put thousands of dollars because, man, those can be confusing. It's almost like you need a computer software engineering degree to figure out some of those things. I love this stuff, so I took the time, but it was a lot of frustration, a lot of long nights. I don't think it was worth my time. Still wanted to learn. And then there's something called Digital Guide where we could actually have labs design the surgical guide for us, and then we 3D print it in our office. So there was still the cost to design the guide, and there was still time because you're waiting on a lab technician to design that guide for you. So there still wasn't the sweet spot. Now with AI, there's something called Rapid Guide. It got all the way to 25, but still you had to wait on the software to do it, and it wasn't fully in my control until we got the prime print. Okay, so once we got the prime print, I was able to take my surgical guide design completely in-house to where we were going from start to finish without having to use a middleman, and we got the cost down to under $5, right? So really made it to where I could produce a surgical guide really easily. Okay, so the cost under $5 per surgical guide. So it makes it to where every single implant I place now, I do guided. It's kind of like, why not? Time. When you're doing guided surgery, at least for me, I find that the procedure goes a lot faster. You're not sitting here stopping and taking all these different measurements. All of that has been done in the planning time. So it makes the implant placement a really fast procedure. You get complete control. So for instance, I have a patient who was very comfortable with us and they moved to Missouri. Okay. And they just recently called. They said, hey, I have a missing tooth, lost one. I want you to place my implant. So I'm going to fly in, make it happen. Right. So normally someone flies in, you can't really get the scans and produce a surgical guide from a lab and wait for them. He flies back. Doesn't make sense. But with this, he's coming in, we're scanning him in the morning, we're designing our surgical guide. He's going to go to lunch, he's going to come back, and we're going to place the implant in the afternoon. So that's some of the benefits you can have from having complete control. And then the precision. We'll show you with some slides why that's important, but you want to avoid nerves, you want to avoid complications, you want to precisely place these implants. So that way, you as a clinician can deliver, and you can start to maybe take on some more difficult cases when you build up that confidence. Here's just an example of some of the confusion I had before. This is the third-party software game that I was in. Here's some of the slides from my previous lectures. You were buying stuff off of Amazon. You were having to do math. I don't do math. You had to calculate the sleep position. You had to know your offset. If any of your math was off, you could have a drill into a nerve. It was crazy. Now with my workflow being simple, I don't do any math. All of the sleep position is calculated for me. It makes it to where I can get a surgical guide, an accurate one, really easy. And the prime print really is what made it possible. You're not dealing with sticky resins. All of it's controlled. I'd recommend anybody who's getting into 3D printing look into it. It's something that's assistant driven. So I'm not sitting here having to do the 3D printing. It also comes, and the reason why the prime print was important, because it comes with in-lab software. Okay, so any 3D printer can print files, but you have to come up with that said file first, right? So if you have just a 3D printer but no software to produce the surgical guide, you are still having to use a lab. You still had to use some kind of third-party software to design and make the surgical guide. With the prime print, it comes with in-lab software that you can design your surgical guide in-house. And here's, since we got it, we've been printing guides like crazy. You can print, here's showing how you can produce multiple guides all in one print. And we haven't stopped ever since. All right, let's show some cases. We gotta show some surgery to get us excited. So this is Grant. All right. He came in complaining of pain on the upper right. Your traditional two-dimensional image didn't necessarily show anything. Look in the mouth, hard to necessarily see, nothing jumping out right off the bat. So in this case, what do I do if someone's having pain? I get a cone beam. All right, I look in 3 dimensions, what's going on, and sure enough, he had cracked his tooth all the way to the gum line, to the bone level. Pretty much non-restorable. I talked to him about his treatment options. He was actually amazed. He even said, I'm amazed you knew exactly what tooth it was. You hadn't even come in the room yet, because I had already seen the CT scan, and I can confidently diagnose and treatment plan this patient with what he needs. So we decided to do an immediate implant. Here's with the Intro's camera, you can even take a video. Sure enough, we numbed him up, and that whole entire lingual cusp moves. All right, so moving forward with an immediate implant. All right, so day of, we planned it. We printed our surgical guide. We extracted the tooth. We want to be careful to preserve that buccal plate and bone. He gave me permission to show these pictures, of course. But so sure enough, here's that cracked tooth. Here's the extraction site. I cleaned it out, debrided, irrigated, and then here is my surgical guide placed on the teeth. Some of the things that I love about these guides is you can place inspection windows wherever you want. You have complete control. So that way I can ensure that guide seats all the way. So here's that guide seated. You can see these things fit so nice. No adjustments, they go right in place. Um, the the kit I used for this one was the prime taper implant, and then they have a fully guided kit. Something that I love about this kit is they're keyless. You know, sometimes if you are familiar with implants, you have all these different handles and you're switching things out. Makes it for difficult surgery. Remember how I love easy? Well, this guided kit makes things easy. The sleeve is on the drill itself. It's designed to fit that surgical guide perfectly. And even as far as placing the implant guided. So that to me is very important, especially when you start to get into immediate implants. You need to be able to place the implant through the surgical guide. Otherwise, it can deviate. Sure enough, you never know. So some kits, if you're looking into them, make sure you can place that implant through the guide itself. So extracted, we did graft. I do that final osteotomy one more time to push that graft material to the side so that way my implant goes to length. So here's our implant placed. We do just a membrane over the top, a few stitches. I put the healing cap and kind of bury it so the gums, it all heals up nicely all together. And here is about 10 weeks post-surgery. He comes in, you'll see how the tissue, just with these immediate implants, it heals up all together really nice. And so you'll see just really well developed contoured tissue around your healing caps. Here's with the healing cap off. We're taking the digital impression, no gooey stuff. We use what's called a scan body or scan post. Here's with that scan post seated to make sure that all of that's real accurate. And then we went to as far as even milling this out in-house. This is milled from solid Emax. So they make these Emax blocks, so you can mill out a fully contoured screw-retained crown. Of course, you can play artist, do your staining and glazing. This is all assistant driven. It's something that gets your team excited. They love doing this. They love expanding their skills. So you can stain and glaze, make these things look nice. Do multiple at the same time. And here's our final result after it's been centered. They look beautiful. They're strong. Never had one of these things break, and that's the day of C. And here's our final X-ray. So let me show you a quick demo of Grant's implant on how I planned that immediate implant so you can get a feel for what the software looks like. All right, I'm going to switch my screen. I want to make sure everybody can see that. Okay, so you should be looking at a cone beam now. Can I get a confirmation in the chat? Can you see Grant's case? Perfect. All right. So here's Grant's. Now this is how I planned his case. First of all, you'll see we merged his intraoral scan to the cone beam. The first thing you want to do is make sure you got a good merge, a good stitch, it's called. So down here in this bottom screen, what I like to do is this orange line is your intraoral scan on top of your cone beam. You want to go through that and make sure you see a really nice stitch. Okay, the guide is 100% accurate as long as you give it good information, right? So you got to make sure this is nicely stitched. So that looked great. And then from here, you can place the implant. You'll notice that when you go to add an implant, You select what tooth. Let's say if I was doing a different tooth, it has an entire implant line. So pretty much any manufacturer is in here. So you'll know I do Dentsply Sirona implants. I keep it all in the family, but if you place other implants, more than likely it is here. So you can place that in here. For this one, I did a prime taper, 4.2 by, I believe, yeah, by 13. All right. So we come in here, you can come in here, place the implant. When I'm doing immediate implants, there's a few things I want to look at. One is, am I going to get some engaging threads into native bone? Okay. The number one thing I want to see with immediate implant is primary stability. The prime taper implant is specifically designed for that. It's more aggressive here in this apical third. So you get some really good grab on that bone. And then towards the top, it's a little less aggressive, chance for less bone loss there. It's been my go-to implant for immediates. But then once you get it basically where you want, you can rotate this in 360 degrees. And you can make sure, for instance, that here we're getting maybe a little too close to the sinus. You can pull that away, rotating back through. What I like to see on his case is starting about right here. So halfway down the implant, it starts to engage in native bone. And so there's a really good chance I'm going to have good primary stability. Still a conversation I have with the patient, though. I say, hey, our goal is to place this implant. Same time we take the tooth out, but there is a chance if the bone isn't quite ready, we may have to do it in 2 stages. So you're informing them ahead of time, and you're informing yourself as the dentist. You're going into this case with eyes wide open. You know what you're getting into. Once you have the implant placed where you want, you can even see where the sleeve location will be. That's important because you want to make sure that the sleeve will fit in between the teeth. You want to make sure that your patient can open wide enough, let's say in the posterior second molar. I always kind of see where my sleeve is going to be. That way I can think ahead of how the surgery will end up and what things may be difficult. And I may change my sleeve position or change my implant height so that way my sleeve is lower, for instance. From here, I go and you can print out your surgical plan for the day of surgery. That way, any notes, anything you want to add there, it's all ready to go. Sometimes I'm planning this a week or two ahead, so if you're forgetting, I have this ready for the assistants too, to have the implant ready to go. And then I can export this plan into the in-lab software where I design my surgical guide. Okay, so with this button right here under Treat, I export this file to the in-lab software to design the surgical guide. We're still doing good on time, so let me just go ahead and jump right to that. So we've planned our implant. We have it exactly where we want to go. Now, how do we produce a surgical guide from this? So let me show you. Okay. Now you should be seeing a model with the surgical guide, kind of a ring circle. Do you guys see that? Confirm in the chat here. So here is the in-lab software. This is kind of the first initial screen that you see. It lays down a generic surgical guide. And now I'm going to tweak it to where a few things I want to see on my surgical guides to get this more ideal. All right. So first and foremost, I want to add a little more stability. Let's say I want to take that surgical guide farther, maybe towards the midline. I start with this Adapt Seating Area button. You'll notice as I highlight across, it automatically highlights the teeth. You see that? So AI is built in. It knows what's the difference between gum tissue and teeth. Let's say I want to take to the middle. I just click there and I hit apply. And within a few clicks, I have that guide now extended to the midline. Inspection windows, super important. I got to make sure before I do any drilling that that guide is fully seated. So my implant's going to go where it needs to. So I'm going to add some inspection windows. I like to put one distal to the site. So like that, you can move it around just by holding down left click. You can change the size of the inspection window. I like to put one kind of around the implant. This sleeve position's higher, but sometimes you can actually see the tooth seated on either side. I'm going to put a few inspection windows to the mesial of the implant site. You can put as many inspection windows as you want. Normally, I just space them out evenly, just like this, so that way I can inspect and make sure it's right. So once I have my inspection windows, I just go to finalize. It may show you some areas where the material might be a little thin. You have all these different tools where you can add. So for instance, if you're seeing some red area like this, that's indicating it might be thin. If I just right click, I can go to this add button. If you're familiar with Cerix software, it feels the exact same. Same tools, same icons. It's all in the same family. Here I'm just adding some material, holding down left click. So that way, maybe bulks up that material a little more. Just right here, let's say I want some more integrity around the sleeve. Let's bulk that up. Around my inspection windows, I'm not worried about any kind of redness, but just a few touch-ups there, and my guide is ready. This is where I turn it over to my assistants. We export it to the CAM software. They 3D print the surgical guide. They remove the sprues, they sterilize it, and they place it all in a box with that plan. So that way it is ready to go, day of surgery. I was walking you through, talking as I go, so you notice how long it took, but I'm telling you, normally this may take me 1 or 2 minutes now to design these surgical guides. I do have an assistant who's also very competent and can design these herself as well. So within a matter of minutes, you have a nice 3D surgical guide that you did from start to finish in office. You're printing this. It's ready to go for that day of surgery. All right. No questions in the chat so far. I'm just going to keep plowing along. Okay, I mentioned my team a lot. You'll notice got to get the team involved. Before, when I was dealing with other 3D printers, I was taking it all on myself. I was spending a lot of time there. There was a lot of chances for error with the other printers where I just didn't feel confident turning it over to the team, but it just ate up my time and made the surgical guide design process cumbersome. You know how I like it easy. It's got to be easy. Involve the team. Can't tell you how much. This is my team. They mean everything to me. You'll find that they love learning new things. Whenever that patient cancels and you're like, oh my gosh, what do we do? Hey, that's a great time for the team to go in the lab and design next week's surgical guide, right? Here's another one of my employees. It's my son, 6-year-old Leo. I don't employ him, but he wanted to print his model so we can design a sports card for his team. It's so easy that even a 6-year-old can do it, right? So adopting that technology makes it possible. Here he is ready for his flag football coming up. He's going to be quarterback. So All right. So last contributor I want to emphasize is placing implants leads to placing more implants. Okay. What do I mean by that? So one, as you get more confident, as you find that this workflow is easy, you're going to be able to take on more complex cases, right? So cases where you would typically refer to a surgeon, which I do gotta say, I love my surgeon. Still, are there cases that I'm not comfortable with that I refer? Absolutely. You can share that cone beam, share that intraoral scan all through the cloud now. So do what you feel comfortable, but you'll notice you start with easy, but you expand into more complex cases as you find that the technology makes things predictable, makes it to where you feel more comfortable taking on the cases. You'll do more implants. One thing about implants is you actually get repeat customers compared to something like veneers, right? You do a veneer case, you do it that one time, you do the 10 teeth, and you hope you won't have to redo those anytime soon, right? Where implants, someone may lose a tooth on the bottom, you give them a very great experience with the whole implant process, and sure enough, a few years down the road, they happen to lose another one. Guess who they're going to go see? They're going to go see the one who gave them that good experience. So you're going to get repeat customers. You'll do more implants. And then you can expand your services kind of along the lines with the complex cases. At first, I was just doing single units. I started doing multiple units. And now we're doing all on four implant retained smiles using the same workflow and boosting production from that. So let me show you one of those complex cases where, without this technology, especially when I first got into things, this would have been a referral for sure all day for me. But we took this on and gave this patient a good experience. So this is Jack, upper left, two non-restorable teeth, 12 and 14, missing a tooth at 13. Okay. Here is our two-dimensional X-ray. He had quite the infection. So here's a cone beam, a lot of bone missing. We had to do a guided bone regeneration. This was not an immediate implant case, right? We extracted, we grafted, we let things heal, and then we brought him back to plan out the implant. Some of the grafting materials, just go over some materials I like to use. I typically use allograft, the mineralized cortical cancellous granules. If I want some slower resorbing, let's say to almost establish a new cortical plate or wall, I'll use xenograft. Or in a site I'm not planning on doing an implant, I'll do xenograft. I love the OS6 line. They have OS6 Bone, OS6 Plus, and Volumax, and they have a new membrane called Agile. Volumax gives a little thicker membrane for something like a buccal defect. OS6 Plus is your typical collagen membrane that I'll use in most cases. OS6 Agile, pericardium. So different uses for different places. We went through the whole process on this one, right? We use all of our technology. We use our intraoral scan, cone beam, our 3D printer, and our mill. All right, so start to finish. So after things have healed, we grafted, let that heal up. We proceeded to plan out our implants, okay? With him, we gave him the option to do an implant bridge or 3 separate implants. He decided he wanted to be able to floss in between his teeth and wanted the potential longest lasting, so we went ahead and planned out 3 implants. Here, I had to educate him. At site number 12, plenty of bone, but notice on site number 13 and 14, his sinus dipped into the area where we wanted to place the implants. So I described to him how we're day of procedure, we have to do what's called a sinus bump. So that way we can place the adequate length of implant. And from our plan, we designed our surgical guides. With him, this was kind of interesting. We did, because it was 3 in a row, if anybody's placed implants with a surgical guide and it's the most distal tooth, meaning there's no tooth support behind the guide, one thing you can see is if it's a floating sleeve and you go to place the implant, it has a little bit of a give, right? Well, because I have complete control over my surgical guide design, I use that adapt seating area tool and I added a soft tissue pad to give it a little posterior support for the day of surgery. Because I'm the clinician who's placing the implant, I know what complications can arise. I'm different from some lab technician that's out of state that's designing this. You can really bring in that control so that you can avoid troubles and you can self-calibrate for future cases. So it's easy to print a guide. I ended up printing 3 separate guides, just I wanted it as stable and as accurate as possible, but it's no big deal. I make these myself. So we printed 3 separate guides for each implant. So and we're also placing an implant on the lower right. So here's our 3 separate guides for that top left, one for the bottom right, day of surgery. Here's the surgical guide seated. Because I'm doing this guided, all I have to do is a tissue punch. If I can avoid a flap, I'm a happy dentist. Not to say that they're not necessary sometimes, but a tissue punch makes it so much easier. I feel like it's easier on the patient. The post-op healing is easier, less pain for them. Love the fact with guided surgery, I'm not having to release a flap, I'd say most of the time. So we do our 3 tissue punches. Here's 3 implants placed. We place our 3 healing caps. I kind of use the whole rainbow. We did a 3-6, 4-2, and a 4-8 as we went back. So here's the bone. Here's our 3 implants. We were able to get a really good sinus bump in these cases. Probably could have gone longer even in this instance, but 3 nice stable implants. We got our healing caps on, and we waited the 12 weeks. And here's what it looks like after 12 weeks with the healing caps off. Beautiful soft tissue. I recommend not your typical stock healing caps. You want really good tissue formation. I love the healing caps that come with prime taper because they're in all different sizes to start preparing that tissue. We took a digital impression with scan posts. I made sure with an x-ray that they're fully seated. And we proceeded to mill these out in-house. He did not stay for these. I did schedule him back. Could I have done these same day? Yes. But typically I do this in a second appointment. But we designed these, milled this out of a fully contoured Emax, stained and glazed, got them ready, and we seated the 3 implants. So here's our final restoration. And remember how I said implants lead to more implants? Sure enough, he had a great experience. Things went really well. A few months down the line, he wanted us to take on the upper right and get him another implant here on the top right. And so he was confident because we gave him a good experience. I was confident because the other side went so well. This sinus lift was a little more intense. The bone was thinner, but I informed him and he said, I don't want to be referred. I trust you. And so we did it, move forward, and it turned out really nice. So implants lead to more implants. And then here's him today. So just on this one patient, placing 5 implants. That's how you're going to increase your implant production in your office. I already showed you the surgical guide design demo. I want to end this with just the final case of, like I said, as you get better with the technology, as you feel more confident, you're going to expand your treatment. And so here is a case where we did an implant retained smile. Okay, so this is Oscar. His lower dentition was failing. He was losing another tooth at 19. He didn't like the looks or the gaps. After discussing his treatment options, we thought the best thing to do would be to do the implant retained smile on the lower. So I find those can be pretty complicated. I've gotten into some train wrecks on these, all right? There's different ways to go about it. Do what you feel is comfortable. I love, where possible, tooth retained surgical guides. I think they're strong, they're accurate. I'm not having to lay this humongous flap. You've seen the layered guides. I've done those. I've fallen into place where, if wherever possible, I try to do tooth-borne surgical guides. And so that's what we did. We planned out our 6 implants using his cone beam. The way I was able to do this is I actually 3D printed his lower teeth. The locations where I wanted to place my implants, I physically removed those teeth from the 3D printed model, and I imported that into my surgical guide planning software here. So that way I could place these implants while leaving teeth in place to support the surgical guide. So here's kind of what that looks like, right? So I virtually extracted on the model places where I wanted my implants to go, teeth that I knew I had to take out before placing the implants. And here's it seated on the model. And now I know I just need to reproduce this 3D printed model in his mouth, day of surgery, so that my guide would fit. So I extracted the teeth that I had virtually extracted. I adjusted any places where it might have been tight, so that way I could seat my surgical guide. I didn't have to lay a humongous flat for this, which I love. And then again, because it's an immediate implant in this case, you got to do it to where you can even place the implant through the guide. So how this works is um, the implant carrier, the width of that is the same width of the sleeve, and it has these different notches, which, depending on the length of the implant, that is your level where you want to make it flush with the sleeve of the guide. So that way you know you're placing it to the right depth. So we placed all 6 implants, we extracted the teeth, we bone grafted, we even placed the abutments on the implants, so that way, and a healing cap, so that way the soft tissue would heal up really nice together. So here's what that soft tissue sutures removed. We took a digital scan using all-on-T abutments from True Abutment. They're designed to fit over the multi-unit abutment. So I love to get my final impression with a multi-unit level digital scan. They're really accurate. I don't even need to do any verification jigs anymore. I found that these things seat and fit perfect. So here's the PMMA temporary that he wears while things are healing, while implants are anchoring, soft diet only, and let things heal. We worked out kinks, we worked out looks, color, we worked out his bite, and proceeded for the final. This one I did send to a lab. That's my next evolution, is getting a puck mill so I can mill out a full contoured zirconia like this in-house. I'm probably gonna do that someday. That'll be another lecture. But this one we did have our lab. I love our labs, do amazing work. And here's it seated, and you have yourself a implant retained smile, all using that technology, boosting your amount of implants you'll place, boosting the treatments you offer, boosting your confidence in dentists and overall satisfaction. I really encourage anybody who's looking into this, wherever you are at, invest the time in your education, invest the time in the technology, reach out to mentors that's who I did. There's amazing helps out there, and just yeah, appreciate everybody for being on here tonight. Just want to open up to some Q&A and some final thoughts. So um, let me know if there's any questions from here.
Thank you so much, Dr. Titenstar. That was really fascinating and such a detailed look at your detailed plans and your guides. So thank you for that. And we do have a couple questions that have come in. So I am going to go ahead and jump into those. This is from Dr. Urtiza Abbas. When you print your own guide, how do you put in the metal sleeve? Is it glued with resin and cured?
Great question. Yeah, so you'll notice on my surgical guides that the sleeve itself, because I do get this question off, like if you're 3D printing surgical, is that going to be strong enough for the drills? It is, because the sleeve is metal. These sleeves are specifically designed for my implant. I ordered them through Schein. They're autoclavable and they fit perfect into that 3D printed guide. Honestly, they fit so snug. I usually just, the assistant will just push it in. If you're worried about it being loose at all, I'll do one tiny drop of super glue. Okay, one little drop of super glue, seat that, clean that up, and then you sterilize the surgical guide for surgery. But that way, you can actually reuse this, right? So surgery's done, you autoclave the guide again, you clean it up, punch out those sleeves, and you can use them again for another surgery. They eventually wear out and you'll replace them, but they're very inexpensive. So that's how I do it.
Thank you, Doctor. This next question from Dr. Seema Schumer. You use Emacs in-house. What about the abutment?
Great question. So you can mill out a fully contoured Emacs abutment and have a cemented crown on the top. I try to do screw-retained where it's one piece. What you're doing is, let me get back to where I had an abutment so I can show you. Let's do this. Back for Grant's case, I showed that. Here we go. So this is Grant's screw retain implant crown. The crown itself is a fully contoured Emacs that is bonded cemented to what's called a tie base. So this tie base is titanium. This is made to designed for whatever implant you use to seat in there. So you're not actually screwing in an Emacs into an implant. It's the tie base, which you order per case and depending on what implant you use. And that's what's going into the implant itself. So it's really simple. My assistants do that once these are designed, made, and sintered. There's a few simple process to cement that tie base to the implant crown so that it's ready for day of seat. Does that
Fascinating.
answer your question?
It does. Thank you, writes Dr. Schumer. Thank you.
Perfect.
And this next one comes from Dr. Casey Colson. If you were a fourth-year dental student today, how would you get started on your dental implant journey?
Hey, Casey, are you a fourth-year dental student right now? Can I see this in the chat? I don't think I'm able to see.
I'm looking, oh, yes, Casey
Oh
Colson
my
is.
goodness. Hey, so glad to have you. You you remind me of me. Um, I love this stuff. I got to it into dental school. I even went to continue education during dental school. I went to Baylor. They had technology, but they didn't really teach it. And I knew it was important to me. And so CDocs, for instance, they offer 3D printed heavily discounted continuing education courses to dental students. And so that's where my journey started, was even during dental school. I wanted to learn how to use the technology. I wanted to mill crowns same day in dental school. And so I went to those courses and it really just skyrocketed my career. That's where I met mentors. That's how I eventually got into teaching. Opportunities open up like that. As far as definitely for implants, you gotta take in a continuum, it's called. Um, I strongly believe in, you gotta have some credentials, especially as a general dentist. I don't recommend, for instance, watching this one webinar and then start placing sinus lifted implants, right? So I took an implant seminars continuum. It was over a course of a couple years where I go, it is a big investment, but guess what? It pays off dividends. So as a fourth year dental student, Casey, invest in yourself, invest in technology, and invest in continuing education. Take a continuum as soon as possible. The sooner you do it, for instance, I have an associate. He's 2 years out of dental school. He's already placed 12 implants. Um, and he took a expensive continuum, but he's already made up the money. So don't hesitate. Dive right in. I'm excited you're here today.
Yes, that is exciting. Welcome, Casey Colson. This next question from Jameson Hook. So you graft the socket prior to final osteotomy and placement.
Yeah, Jameson, great question. So um, I've done it both ways, right? So an immediate implant, you can take the tooth out, you can do your osteotomies, and you can place the implant and then graft after you place the implant. The only problem I found with that was it's really difficult in a lot of cases, especially in like premolars. It's really difficult in anteriors, definitely. It's difficult to get that graft material all the way down past the implant, right? And so what I found that's worked really well for me is I'll do all of the osteotomies, even my final osteotomy. So I have the bone drilled out, ready to go. I will do my bone graft. I will kind of underfill it, so that way it's not, completely filled. But I'll do the bone graft. I'll use allograft, and then I'll take my final drill, my final osteotomy that goes all the way to length. I will do that final osteotomy one last time, usually on lower RPMs. And basically what it does is it takes that bone graft material and it just pushes it to the side. So that way, when I place the implant, it just pushes that bone graft and fills in all of the remaining space around like an immediate implant site. And now I'm not having to try to tuck it in after the fact. And so that's worked really well for me. Just make sure you don't overfill it. Make sure you have enough room for that bone to kind of push out around the implant. But that's been a really good way for me to do it.
Well, thank you, doctor. We don't have any more questions that have come in. It is the top of the hour. So we are going to wrap it up now, but we want to thank you again for a really wonderful presentation. And thank you all for joining us. As I said before, we did record tonight's webinar and we will be emailing the recording out sometime in the next week. We'd also appreciate your feedback via our survey that's going to pop up on your screens shortly. Dr. Titensor, thank you again. I'll have that image of your 6-year-old using
Ah,
the 3D printer. That's very cool. And well, with that said, I wish you a wonderful night and thank you again for a wonderful presentation.
hey, thank you, everybody. Have a great night.
Have a
Appreciate you
great night.
sticking out.